I think most of you know who everybody is, so let me just get to why we called this press avail. Today, we confirmed the first case of the swine flu here in the city and county of San Francisco. Last night, around 10 p.m., conducted a series of tests. This morning, we confirmed those tests with the private physician of a young child who is not in school and not in child care, that this child has, we believe, contacted the swine flu in Mexico, not here in the city and county of San Francisco, and as a consequence felt it was important that we communicate that directly to you. As a consequence of this last 4 or 5 days, a series of other things have also happened that I want to put in perspective, because I don't want to frame them as a reaction to this first case of swine flu in the city and county of San Francisco. One is this: we have partially activated, and we initiated this before this case, our Emergency Operations Center in order to coordinate and collaborate both an internal framework in terms of communication and an external framework of communication with school district, with city departments, health and human service leaders, not just within the city and county of San Francisco, but through the state and the federal government. Second, as is the responsibility of the city, not in reaction to this first incident, and I cannot underscore this enough, because as we have been saying earlier, it's much easier to contain this influenza than it is to contain the panic that it evokes. And so I want to frame this in this way. I have signed or am about to submit to the Board of Supervisors a declaration of emergency that is a responsibility of municipal governments in order to coordinate our federal funding for our efforts associated with the swine flu. I know if I read the newspaper, if I listened to the news, if I saw the nightly reports, mayor declares state of emergency, first case of swine flu identified in San Francisco, that is not going to calm people's nerves. Quite the contrary. So it's incredibly important, to the extent that I can ask you and indulge you, to frame it appropriately. It's really a financing mechanism and a reimbursement mechanism is much more than anything else, this declaration of emergency. The Board of Supervisors nonetheless has to codify and support ultimately its adoption, and that's why we're signing it today. Will be submitted for the board's action on Tuesday, and that's in a deliberative, not a reactive way. We have a number of other things that we would like to share, though again the purpose of this is just to let you know that we do have that first confirmed case. Because of patient confidentiality, we're not going to get into details about how old this child is and whether or not it's a boy or a girl, and not get into any details except to suggest again what I underscored. It looks as if, based upon our conversations with the child's physician, that the child contacted this influenza in Mexico, not in the city and county of San Francisco. The child is not in school, so there's no school issue related to this, or even in child care, so there's no child care related issue with this individual contacting the swine flu. And it looks, always early preliminary analysis, the doctor can confirm the child will be okay. And that's also important to underscore. Let us not forget that 36,000 people every single year succumb to normal course of flu virus and mortality associated with that on any given basis. 36,000. And so we need to put all of this in perspective, is to not put people in peril of not getting on public transit, or for that matter, even getting on an airplane. I think that's important to underscore. People do not need to be running and rushing to get masks. They just need to be thoughtful, as they are during any flu season, to wash their hands, not just get those fancy bottles at the grocery store, but also wash their hands, because the virus does better when you wash your hands and then it does necessarily with the alcohol-based hand wipes and the like, though those are important as well. Sneeze or cough in your sleeve, not in your hands. And if you're sick, stay home, which you should be doing anyway, which I should be doing, but they won't let me. But I just have a cold. But that's important. The school district is very much involved in the dialogue and discussion. That's the reason the partial activation of the EOC. It also connects the public schools, also connects our jails, our health and human service agencies as it relates to shelters for homeless, etc. So all of this being coordinated. 311 remains the depository for information. Another valuable reason we have 311. So people want to get more information or access deeper information about how they can communicate what has happened or what is happening in relationship to our declaration of emergency, et cetera, and put it in perspective. Please encourage them, direct them to 311. With that, I'll turn it over to Dr. Mitch Katz, who is on top of this and has been doing an extraordinary job. And he is here to illuminate my finer points, or my points in a more detailed way, as well as answer any questions that you may have. Doctor.
Thank you, Mr. Mayor. I want to go back to what we were talking about on Monday, because I think it really encapsulates why it is we are not as concerned or as people might think. There are two issues anytime you're facing a illness like this. One is how quickly does it spread, and that's the epidemic part, and how virulent is it? So yes, there are more and more cases, and you will see more and more cases. We had our first case. We will undoubtedly have our second case. We'll have our third case. Yesterday there were 90 U.S. cases. Today there are around 100. Tomorrow there may be 120. So the growth is rapid, but people are not sick. And that's why this is not a health crisis. People have an illness that is resolving. People have an illness that is acting just like seasonal influenza. And so our instructions are, stay home, drink fluids, get rest. Don't go to the doctor unless you have serious symptoms, because we don't want you transmitting even mild illness to other people. You and the media are our tremendous friends and assets. There are many people out there who are frightened, and we understand that. We understand that it can be very scary to hear about a new illness. You haven't heard about it. This is from a foreign country. This is related to animals. This all sounds like a frightening science fiction movie. But what people have to focus on is, what do the data show? The data show of 100 people in the U.S. that we know about who are infected, all of whom, including this child, are recovering. And if 100 children and adults are known to be infected, that means really the number of people who likely have been exposed to swine influenza is much larger, probably more than 1,000, and yet we don't have deaths. We don't have people who are requiring ventilators. So clearly we have epidemic spread, but we have epidemic spread of a non-serious infection. Now we're getting a lot of questions about face masks, and the mayor alluded to it. We do not recommend face masks. We don't feel that the seriousness of the symptoms require that people wear face masks. Some people will want to wear a face mask. That's okay. You might see your Muni driver wearing a face mask. You may see somebody who is in a public service wearing a face mask. To the extent that people wish to do that, we're certainly not going to stop them, and it's not harmful. They're not going to be harmed. They're not going to harm anyone else by wearing it. It does, though, probably for those around, suggest a kind of, well, gee, there must be some serious reason. And that's why we need your help in conveying the message that, yes, epidemic growth, but not a serious illness. No need to wear a face mask, but some people may elect to wear them. Really, if they're going to wear them, then they need to start wearing them every year between about November and May. because that's the season, and probably if all of you started wearing masks every year, all of the time when you're outside, from November to May, I would predict that you will get upper respiratory infections less often in your lifetime. Now, how your friends will feel about you, that's a different issue, right? But so we don't want people to feel bad about the decisions they make, but we also don't want to do anything to increase panic, because this is a mild illness, and that's our most important message. So with that, I have Dr. Ferniak, who has been our person on the street level, working with all the various health departments. Our terrific fire chief is here. Vicki Hennessy from the Department of Emergency Readiness is here, as is Virginia Safaro, who has done a great job at 311 answering the entire city's questions. So with that, for the mayor or for myself, we're open for questions.
Has this case been confirmed with the state or the CDC?
Yes.
Regarding the face masks, apparently airport workers were told that they're not allowed to wear them, which seems to contradict what you just said.
Right. We had a call this morning specifically for that reason, to make sure, because you're getting, prior to our having the call and setting a city policy, people as individual managers were making decisions. So as city policy, we don't recommend a mask. We're not going to provide masks because there's no basis for that. But we're also not going to, be writing up people who feel better at work wearing a mask. I mean, as a physician, I've often had to do examinations and interviews wearing a mask because the person had a truly serious disease like multi-drug resistant tuberculosis. It does hamper communication somewhat, but it's certainly not impossible to do your job. And we don't want people to feel like we're pulling their mask away if that's what they need to go to work.
So just a follow-up, so now the airport workers are being allowed to...
Right. We as a city, we made the decision that while we do not recommend it and we will not supply it, we also will not prevent people who feel better coming to work. We understand that people, when it comes to disease, people have fears that whether they're based in the data, they are real to that person, and we want to honor that.
And just one other thing, do the masks work? I mean, do they actually, and what if people want to wear masks?
Right.
What
So,
do they get?
right. So, do they work? Yes. Do they work? Absolutely no. The typical mask that you would buy in a pharmacy will provide some level of protection. Certainly, I would, as a physician, never use that if I were going into a room with a patient with multi-drug resistant tuberculosis. I would want an industrial style, and that's what I would use, mask. But do the masks that you see work somewhat? Yes. They probably work better when you first put them on than when you talk, because as you inhale and exhale, the humidity in your air as you inhale and exhale wettens the mask, and as they get wet, they don't work as well. But yes, they provide some level, just as you would common sense expect that they would.
Mitch, can you give us some details without the patient at all, the mechanism of reporting? Was it a hospital walk-in? Did a doctor alert you? How did it happen?
It was through a clinical interaction. So symptomatic child. Symptomatic child, went to the doctor, had a culture. Culture was positive last night, confirmed this morning.
If it's a child in school, are we looking at shutting down school?
Well, that's an excellent question. Both the federal government and the state have asked that in cases where a child is found to be infected in school, that the school be closed, and will be compliant with the federal and state rules.
Dr. Katz, what about the idea that some schools, reports that they are sending kids who have sniffles and whatnot right to the hospital to be looked at? Is that a recommendation you would?
Not endorse, right. It's a recommendation I would not endorse. So part of bringing the EOC together, and again, we're incredibly grateful to you, because you're the eyes and ears for the average person to get out the message. But our bringing people together is to communicate clearly that no, people who we do not want to send people with mild symptoms to go to emergency rooms. If people have a cough, the student has a cough, the student should be home. right? We don't want sick people, and again, that's the same as seasonal influenza. People who are sick and coughing should stay home, right? They're sick. But no, we do not recommend sending people to doctors' offices, because that's only increasing the chance that people are going to transmit their mild illness. And we've conveyed that to the school. The school system has been part of the EOC. But again, the value to us, there are 800,000 people in the city and more who come in, and it's hard to get out the message to everyone. We set up our EOCs, but that doesn't mean that teacher A in school F has fully gotten that message yet. Well, let me do her. Good.
No, he's
Right.
not in school. Charles is
We
not in
will
school.
have May 1st marches, and on Sunday, Cinco de Mayo. Do you have any concern about those events? And in what case you would think in banning something like that?
Right. We do not intend to ban those events. We do not think that it's necessary to take any special precautions about large events. In general, certainly any outdoor gathering itself would be of the least concern, because in the outdoor you have large circulation of air. But even indoor gatherings, right, our focus is on, if you're sick, don't go to the gathering. Stay home. That's what we want people to do. If you have to sneeze or cough, cover it. But we're talking about an illness which is, growing in number, but which is causing cough, nausea, sniffles, and then getting better. Right? You don't curb people's civil rights and their right to assemble because of an illness that's causing people to cough and sniffle.
How many potential cases is the county investigating?
Well, essentially every child who's seen, or adult who's seen in a healthcare facility who has symptoms consistent with influenza will get a swab. That's a large number of people potentially getting tested. On the other hand, we're not looking for cases in the sense that we don't want everybody who has a sniffle to quick come to have a culture, because that doesn't help us. We know that there is swine flu in California, in San Francisco, in the United States. It will likely continue, but as long as it remains a mild illness, we want people to stay home where they're not going to transmit the illness and come and seek medical help because they're having difficulty breathing. A situation we haven't so far seen, but it's always possible. Again, as the mayor said so aptly, 36,000 people a year die of seasonal influenza, usually the very elderly and the very young. Those under 2 and over 70, especially with respiratory illnesses, are at risk.
How often are those tests turned around?
Daily.
Daily?
Yes.
How many hours approximately?
I can't do the hours.
Well, they've got it in the state level down to 4 hours now, I
Yeah,
think.
that's
Yeah.
what PCR runs it.
Is
Yeah.
the state and federal government, in your mind, overreacting? Is the city underreacting? Because there's kind of this mixed message,
We understand that.
It's not really an emergency. We're declaring an emergency to get federal money. So it is kind of hard to balance out.
Very hard. I think what we're obviously, anytime you have a political divisions, people respond to different issues that they have. What the mayor has said to me is, Mitch, I want the response based on the science. I don't want it based on politics. I don't want it based on perception. I want you to do what is right. And so sometimes it seems more heroic if you go around, I close this, I declare that, you can't do that, I ban you from that. But if that isn't the right thing, the mayor has said, Mitch, don't do that. Right. So we're walking a fine line ourselves, where other authorities, for example, we learned on the conference call that some transit authorities, not Muni, are issuing masks. Right. So here it is, I'm saying to our Muni drivers, you don't need to wear masks. And that is what is supported by the data. Right. Unless they were wearing a mask, a month ago, there's no reason for them to wear a mask now. So that's supported by the data. Doesn't that mean it's rather confusing, though, for them if their, Sam trans person, is wearing a mask? But I can't help that, and I don't want our response to further misconceptions. I do think that we're looking at, how people respond to a disease, especially one that's perceived as foreign, coming from another place, maybe another place that people perceive as not as developed, and related to animals. And that causes a certain level of fear, and we have to honor it without furthering it.
What's the incubation
For Dr. Ferniak.
Good morning. We actually don't exactly know yet. So we know it's probably around 2 days, but it could be as long as 7 days. So we're recommending, say, for example, someone does travel somewhere where there is circulating swine flu, that they monitor symptoms for 7 days. And if they make it past that 7-day mark, we say, oof, you're home free.
And would you, from what you know, can you get it from someone who has no symptoms, who maybe was infected, but 7 days or 2 weeks have passed?
Right, so again, we don't know for swine flu, but we do see that with seasonal influenza. So every year there are people who are infected with the flu, have barely any symptoms or no symptoms, but we know they're transmitting disease.
So in this case, will you do any backtracking, like to see who's exposed, or do you just wait for symptoms? Or?
So I think, a really important point here is that, again, what we're seeing now is really mild disease. And so what our emphasis, what my group is really focused on, is making sure that if we start to have cases of severe disease, we hear about them right away. We have daily conference calls with our hospitals. We're asking the infection control practitioners at those hospitals to go by their ICUs every single day and let us know if they see cases of people with flu-like illness who have been admitted to the ICU. We're also asking all clinicians who see someone who has very severe disease to call us immediately, because that's really what we want to stay on top of, right? If everyone has mild disease, this is going to be just a bad flu season. But if we start to have severe disease, it could be more serious, and that's where we really want to stay on top of. So we're trying to stay on top of any severe disease, but we're not looking back to see if someone had asymptomatic swine flu. It doesn't really help us.
Well, like the parents of the child, would you test them?
So just like with other diseases, like for example, whooping cough, if we have a case of whooping cough, we interview everyone in the family and we figure out who had symptoms and who didn't, and we talk to them about treatment if it's necessary or prophylaxis if it's necessary. We're treating this just like whooping cough in that way.
Excuse me, there is still a lot of lack of explanation in why it is so bad in Mexico and why we are still saying here that it's mild, and yet we see this boy that died in Texas. So how do you draw that line between which is a mild case or when should we start getting worse?
Right, so I think what's really important to remember here is the big picture. So, as both the mayor and Dr. Katz mentioned this morning, we have 35,000 deaths a year from influenza. We have over 100,000 hospitalizations in the U.S. from influenza. So I don't know, you guys tell me, how serious is that every year? Those are a lot of people being hospitalized and dying from influenza, and we aren't having these press conferences every day, and we aren't talking about school closures during the normal flu season. So right now we've had one death. That death was in a child who we know became ill in Mexico and came to Texas for specialized care because they weren't getting good care in Mexico. Or maybe they were, but anyway, they were very sick, so they came to Texas. So what does that mean? We don't know what that means. We know that we have over 100 confirmed cases in the U.S. right now. We know, as Dr. Katz mentioned, we probably have thousands of cases of swine flu in the U.S., and we only have one death. So put that in the perspective of 35,000 deaths a year from seasonal influenza and over 100,000 hospitalizations.
So is Mexico overreacting?
So what you need to think about what's going on in Mexico. First of all, the CDC has been working daily with Mexico and the World Health Organization and also the Canadian health authorities to try to understand what's going on in Mexico. And I think, to put it shortly, there's not good information actually about what's going on in Mexico. They don't have the same surveillance and testing capabilities that we have in the U.S. It could be that half the population has been infected, and if half the population has been infected and they only have 100 deaths, how serious is that when we have 35,000 deaths a year in the U.S. from influenza? So It's, of course, deaths are very alarming to people. It's very frightening. Everyone is very concerned. All of us are concerned about this, and it's a top priority to stay on top of it. But we need to keep putting what we know in perspective of what happens every single year during seasonal influenza.
But how can you do that when you hear that every day that the things worse in Mexico? I mean, they are every day making things more strict. They don't
Right.
tell you to take out. And
So
all these people that
right.
talking with their family members here.
Right. I totally appreciate what you're saying. And I know in Mexico there have been a lot of larger scale controls that have put on the population, right? Schools have been closed. People aren't going to church. People are wearing masks. People aren't using public transportation. But those are political decisions that are happening. Political decisions don't always reflect the reality of the disease. And as Dr. Katz mentioned, in San Francisco, we're really trying to look, what is the disease doing? What makes sense from a scientific point of view in terms of our response? Let's think about it from that point of view rather than just reacting and say, okay, in Mexico, you know, they're closing universities. We better close our universities in the US. We don't want to think that way. We want to really step back, take a deep breath, think about what we know and make the best decisions we can for San Francisco. And obviously, your concerns about people traveling back and forth and talking to their relatives in Mexico, of course, people are very afraid.
Okay.
Any final questions?
Can you tell us anything more specific about this first case? I mean, that the child is an infant or a toddler, and can you tell us which part of Mexico it came from? Can you tell us which neighborhood they live in?
Right. So please understand that, you know, we're not trying to keep things from you, but this is a real child, and the public health puts maintaining confidentiality, and the rule is that the person should never be able to recognize themselves, even if you can't recognize them. So that's why we can't say, because if I told you the gender and the age and where the person went, then if the child's parents read the newspaper, that they would be able to say, that's my kid that we're talking about, and we don't do that. So, but I mean, in terms of importance, clearly the most important details about the case were that the child was symptomatic. The child is not seriously ill. The child was in Mexico, right? So that's a very big deal because that means that that's where the transmission occurred, not here. And that the child is not in school or in a child care center so that no further closures need to be. And I'm sorry, I just can't offer more details than that without identifying the child. The child was never been hospitalized.
This has been confirmed by the state, right?
Yes.
None of them has the symptoms, the same symptoms?
None of the other family members are sick currently.
Are they taking Tamiflu as a precaution?
I think that's too intrusive to them. We can tell you that we recommend Tamiflu for the household contacts of anyone with swine flu.
What's the status of inoculations in San Francisco at this point?
Well, remember that there is no current inoculation available for swine flu, right? So in fact, that's.
I thought some strain of something was being put together and shipped. That's not the case. That's
No.
6 months lead time.
okay. So
Okay, we're gonna
basically, if you get it, there's nothing you can do about it other than sit home and put it
stay home. Don't infect anybody else. You know, rest. You'll be better soon. Okay, we're gonna just so because we have an orderly, we're gonna let the mayor get back to conducting the city's business. Dr. Ferniak and I.